Hello, everyone. I'm Dr. Gertie Loretta Hurley, the founder and CEO of Taking Effective Action, acronym TEA. Welcome to TEA Sister Voices HIV Chat Series, a roundtable discussion on HIV/AIDS prevention and treatment. Sister Voices is an initiative of TEA, and it is a place where women can find peer support, health education, encouragement, and hope.
Good afternoon, everyone. Part of today's symposium theme is focused on COVID-19, which is a terrible and deadly virus impacting our country and the world. I will be talking about another virus that can and have affected many persons' health and lifestyles. Specifically, I'm presenting on HIV/AIDS among women 50 and older, as you see in this slide. Knowledge and prevention of HIV is key to eliminating AIDS and HIV still plague our community, although improvements have been made over the years. HIV prevention information applies across various groups of people, but today I will also share some information specific to women in this age group that you may not know. I'll also share quality online resources so you can learn more on your own. Before we look at specific groups, let's review some basic information. HIV stands for Human Immunodeficiency Virus and is the virus that causes AIDS. AIDS stands for Acquired Immunodeficiency Syndrome. People become infected with HIV through contact with blood, semen, bodily fluids, or breast milk of a person with HIV. The virus weakens a person's immune system, which allows other infections and cancers to occur more frequently and severely. CD4 cells in your body fight infections. See here as the blue cells, and HIV also seen here as the red cells, attacks and destroy those CD4 cells. If you are infected with HIV and do not take medication, notice how the HIV cells increase and take over, making it hard for your body to fight infection and diseases. If you untreated HIV progresses to AIDS and may lead to death, the good news is HIV can be prevented, and medication, if taken properly, can allow you to live a long and healthy life. At the end of 2018, an estimated 1.1 million people in the United States had HIV. Notice the darker shaded states have higher rates of HIV, and included are DC, Maryland, and Virginia. I know we have attendees from all over the country, but I'm sharing a little information specific to Prince George's County, Maryland, where Taking Effective Action Incorporated, our one and only, and many of today's host partners are based. At the end of 2018, Prince George's County had the highest number of new HIV cases in the state of Maryland and continues to have the highest rates with Baltimore, Maryland. Note that 1 out of every 97 people 13 and older have been diagnosed with HIV. On a positive note, the number of new cases decreased since 2015, but rates are still high compared to other areas. Also, African Americans have higher rates of infection in communities nationwide. So we want to stay informed and practice and promote prevention. Now, let's turn our attention to HIV in women. 19% of new HIV diagnoses are among women. If you look at women broken down by race and ethnicity, 59% of the new cases are African American women. So again, we want to work on prevention in our community. And there are many programs to help you do so. As I mentioned before, the good news is that HIV diagnoses have been going down among women. But we want to continue this trend and continue to reduce the infection rate of HIV and AIDS overall. Now let's consider the age group 50 and older. The number of people over 50 living with HIV is increasing. In 2018, 17% of the new HIV cases were among people 50 and older. Many of you may have known that about this age group. Many risk factors for HIV are the same for people of any age. But like many younger people, older people may not be aware of their risk factors. Older people may also be less likely to use condoms during sex because they are less concerned about pregnancy and the fact that they have passed childbearing years. Talk to your health care provider about your risk for HIV and ways to reduce your risk. Also, get tested and know your status, no matter what age you are. If you are sexually active and not in a monogamous relationship and not properly using a condom, then you are placing yourself at risk for HIV. Protect yourself at all times. The data here show that over half of new HIV cases in the United States are in people 50 and older. We know from earlier statistics that a significant amount are women. However, in the beginning of HIV epidemic, this was not the case. There were more reporting of men who had sex with men and non-legal injection drug users. So we need to be aware that this population is affected now more so than ever, and work to decrease HIV infection in women 50 and older, as well as the African American community as a whole. Given many metropolitan areas, as we've mentioned before, Washington, D.C. and Maryland and Virginia, still experience higher rates than others. There are several programs in this area that work with women to encourage preventive measures and strategic interventions for women and girls. In closing, we must remember that everyone should get tested so you know your status. 2, practice prevention and know HIV affects everyone, including women 50 and older. 3, if infected, see your doctor and take medication regularly and know you can live a long, healthy life. And 4, stay informed, stay healthy, so you can stay alive and help inform others by assessing quality online resources as seen in this slide, and not just accepting anything you read or see on social media. The websites you see here are authoritative resources with accurate information. Note that sistervoice.org is a fairly new online forum created by none other than Taking Effective Action Incorporated for women to learn more about health information specific to them. Lastly, I would like to leave with you these thoughts. We said earlier, stay informed, stay safe, request support if needed to help eradicate the adverse impact of HIV and other health challenges impacting women and women over 50 through education, prevention, support, and human rights advocacy in your community and in your families. Thank you for your time. Again, stay safe all the way around. Stay protected, and I have to say, from HIV and also from COVID-19. Thank you.
We hope you enjoyed today's chat. Be sure to learn more from reliable health information sources and go to sistervoices.org. That's SISTAH voices.org. Then go to the Resources tab in the upper right corner and click on the National Institutes of Health HIV/AIDS Resources link. Get reliable HIV/AIDS information you can trust at hivinfo.nih.gov from the National Institutes of Health. Read, print, or download fact sheets on prevention, treatment, and other topics, like next steps for diagnosis, HIV and diabetes, protecting babies from HIV, HIV in couples, pre-exposure prophylaxis, also known as PrEP, and more. You can also access other health information at sistervoices.org under the HIV/AIDS Resources tab. Click the clinicaltrials.gov link to learn more about studies related to HIV and AIDS or other health topics. You may browse the results or enter other search terms for clinical trials information. Click the medlineplus.gov link from the National Library of Medicine to learn about many health topics, including HIV and AIDS. At medlineplus.gov, you can get fact sheets to learn about diseases, prescriptions, and over-the-counter supplements in medicine. Also learn about genetics and medical tests, and watch surgery videos to understand procedures. Thank you for tuning in to Sister Voices HIV/AIDS Roundtable Chat, where we can talk, share, and learn about topics important to women and our families. Remember to visit sistervoices.org to be sure you're getting accurate health information from sources like the National Institutes of Health. Thank you.